I think there are many benefits for GPs. One of the ones that sort of stands out the most is that after knowing a patient for 20 years, maybe having the opportunity to meet with them for an extended consultation gives you an opportunity to really understand what makes somebody tick and what their priorities are, and to discover things that you might never have known, because although general practice might seem like quite a profound thing that over time you really get to know your patients, in reality you've got a limited amount of time and you may never get to know much about your patients, and so this is allowing one to be much more profound, I think, in the way in which we work.
I do feel supported as a GP. I think that's an interesting outcome of My Care My Way. We do feel that we have more resource now to manage our patients, and it's exciting, and I think that's a positive feeling, and we need, as primary care physicians, to work more in collaboration with other MDT members. We want to see positive change, so we don't want to see changes for the sake of change. This is not change for the sake of change. This is the direction of travel that we are going in, and we are seeing good outcomes with our patients. It's certainly taking a lot of the strain off general practice, and it's putting the resource where it's supposed to be.
GPs are very busy professionals and often have quite time-constrained work in regards to their appointments, and I think it allows it to just shift from just being a medical-based assessment and allows it to bring in the social elements and for more joint care planning to take place. And it allows that transparency for everybody involved as well, because previously in the past what I've noted is sometimes communication can get missed.
The service that I provide benefits the GPs in several ways. One, they get a tailored medication review every time they're seeing a patient, and two, it also helps with educating and training them. Many GPs have said that they actually incorporate a lot of the things that I ask them from the sessions in their own practice afterwards, so it's kind of like the knowledge that I have is filtering out to them.
These patients now are on a lot of medication which have a risk of interaction, they have complex medical needs, and often in the surgery we don't have time to go into that. With this new service we do have time, and we do have the benefit of other resources.
I think My Care My Way has helped patients by making their care more joined up. Everybody does have different skill sets, so for example a doctor would have a different knowledge base to me, so I might be able to help the doctor with the social circumstances and they might be able to help me with the medical side, and that allows a patient's picture to be built up on an interprofessional basis rather than just in isolation. Them not having to tell their story so many times and allowing us all to share our skills together and work together.
So at our integrated care centres, the GP comes together with a range of other experts. They could be people from the voluntary sector, they could be people from social services, they could be case managers or nurses or consultants who might outreach from the hospital. And so that whole team brings the range of skills to best understand a patient's need and to work with them to jointly agree how to provide healthcare.